Thank you. The next question in English is, what is the current
the earthquake? Doctora Etienne.
So thank you again for this question. We can't afford to forget Haiti. So it has been a month since Haiti was struck by the 7.2 earthquake that devastated the southern peninsula and also greatly affected the health sector. So in addition to some 12,700 injured persons and the 2,246 deaths, Haiti has 62 damaged health facilities, including 28 facilities that are severely damaged. 5 of those have been structurally assessed with the support of an engineer from our Smart Safe Hospital initiative, and others are on the list. We urgently need to repair the ones that can be repaired and to reconstruct the ones that suffered severe damages so that we can ensure a continuity of service in those areas. Of course, the emergency phase is over, so now we are entering the reconstruction phase. And PAHO continues to work alongside the Ministry of Health of Haiti to address what are some of the most urgent needs. To support the response efforts of the national health authorities, PAHO has deployed teams composed of 11 technical experts to support with things like coordination, data management, logistics, epidemiological surveillance, laboratory, water and sanitation and hygiene, obstetrics, psychosocial support, and health services. So these PAHO teams work side by side with the Department of Health Directorates in offices that were set up in 3 affected departments, and that was set up by us. We are also distributing medicines, medical supplies, including trauma and orthopedic kits to health facilities, both in the affected departments and in health facilities in Port-au-Prince, because those facilities supported the treatment of victims from the earthquake. Haiti is today being supported by 11 international emergency medical teams, or what we refer to as EMTs, that are deployed in the affected departments. Many of them working really close to what were facilities before, but now are damaged. And many international and local partners have deployed mobile clinics to the affected areas. 6 other EMTs have now completed their missions and have left Haiti. But, you know, regrettably, there are still secluded areas that have not been reached. Primary health services must be reestablished in all areas where health facilities were damaged to ensure that the population can receive health services close to their place of residence. Big efforts are being made as we speak to strengthen the epidemiological surveillance, mainly for COVID-19, but also for other transmissible diseases, both in health facilities and in assembly points, where some 26,000 people who lost their homes are gathered. Health promotion activities encourage the population to follow the public health measures that we've spoken about so much, and to get vaccinated against COVID-19 and other vaccine preventable diseases. I must say that the current security situation is hampering humanitarian efforts, and blockage of the main road leading to the southern peninsula is delaying the distribution of aid to the affected departments. Fuel shortages as well also hinder activities throughout the country. So UN agencies and partners, we are continuing to use helicopters, convoys, and maritime transport to provide support and humanitarian aid to the affected areas. But that is making our work more difficult. I also want to make a special plea to Haitian officials and partners. Please, let's work together to intensify COVID-19 vaccination efforts. So far, Haiti has administered some 52,000 vaccines, and many more people need to be vaccinated. 1% of your population covered with an available 500,000 doses is totally unacceptable. Along with other measures, increasing vaccine uptake is important to protect the country from COVID-19 transmission. Please let us not forget Haiti in a time of acute need. Thank you.